Hello, this is Family Like a Ghost. We're live on the air with Dr. Jessica Edwards. You're a HealthTech CEO, and we're going to talk to you today about why our healthcare system is broken. It's kind of topic for today. But I want to welcome you to the Family Like a Ghost podcast. How you doing today?
I'm doing well, thank you. Thanks so much for having me.
So before we get to the heart of your story, I always ask every guest a couple questions before we get to that. One of the questions is that what motivates you, and why do you do what you do?
Fair. Well, I would say what motivates me is work-life balance. I am a wife and mom of two. So I am motivated by making sure that I can be there for my kids and practice medicine to the top of my ability. I also really love patient care and I love operations. So making sure that patients have a great experience and also being able to balance home is what motivates me to do what I do.
So having that balance is really important because I think that's a hard thing that a lot of people, they're entrepreneurs or business people or people who just have like everyday life is how do you juggle
Right,
like family life with business and career,
right,
continuing education, other things you
for
might
sure.
do, and just figuring out how to do that in a way that doesn't like be detrimental to all the factors in your life. It's like which is like
Right.
it's a hard thing to do. So sometimes it's
Yeah.
like sometimes you need some help doing that. But like how do you? What's your story in terms of founding this health tech company and doing what you do, and how did you come about to this phase of your life?
Yeah. So, what's interesting is I grew up as the daughter of a family medicine doctor who worked almost every day. He was back, practicing back in the 90s when doctors still did home visits. My dad was also a minister, so he would preach on Sundays and then go to his clinic on Sunday. I was like, I do not want to be a doctor because I don't want to, have to work every single day like this. But I fell in love with medicine on my own in high school and then decided to pursue medicine. I was thinking about becoming a pediatrician, but my pediatrician ended up firing me when I was 18. And he's like, "You are too old to be my patient now." And I remember just feeling devastated because I'm like, this has been the only doctor I've ever had the entire time I've been alive. Now I have to kind of pick up the pieces and find someone else. So at that time, I decided to become a family medicine doctor because I never wanted to have to turn a patient away. And then when I was in medical school, I did an OB rotation and kind of fell in love with caring for women and babies and kind of decided I was like, I think I want to just kind of be like Dr. Quinn medicine woman and
Mhm.
be a family medicine doctor and get advanced training in OB and pediatrics, which I ended up doing. And then I sort of never really anticipated becoming an entrepreneur, but I was working at my first job out of residency. I decided to leave that practice, and that practice ended up letting go all of my patients who were pregnant from their practice. And so I was like, I have to have a place for these patients to go. I have to figure this out. So my husband is a Rutgers business graduate, and so he ended up kind of helping me put together this practice in a whim in under a month so that I could take care of my patients. I delivered all like 19 of those patients for free because I was not compensated by Medicaid until like the next, I think it was like the next year, it was like a year and a half or something. And so from there, I really enjoyed working for myself. And my son was also diagnosed with autism. So I found that I really needed to be present to be an advocate for him. And then kind of had a bit of a traumatic second pregnancy with my daughter. And, I understand what health trauma is now. And so I was like, well, maybe it'd be easier for me to, use the skills that I have with my practice to go help other people build their practices, like in a startup environment, et cetera. And then I ended up kind of seeing a lot of these people that are able to secure funding to build practices actually know nothing about patient care. They don't really care about that part, and they're not really good at clinical operations. They might be good at operations, but not clinical operations. So last May, I kind of found myself at a crossroads, and I just decided I was like, I'm going to jump out there and do it again. And I reshifted my focus from wanting to be, the greatest doctor ever to being the greatest mom and wife ever. And so it kind of started to guide my steps more so. So any opportunity that I take now, I make sure that being off and being present with my family is number one priority, especially on days that I have designated for my family. And so it's kind of been the best of both worlds. And I work fully remote. So I log in, see patients, and then I'm still able to get my son off the bus, block off my schedule, put him down for a nap, and then I get back to work.
That's interesting because I've been fully remote. Like I'm a software, my day job. I'm a software design with a startup, and I used to be a road warrior, traveling Sunday to Thursday, traveling all over the place.
Wow.
Lived in Japan, did a lot of stuff. But I decided like I wanted to have like this. I My daughter's an artist, my wife is an artist, and I like being home with my artist family. And
Yep.
my wife is actually undergoing like cancer treatment. I'm a cancer
Oh,
survivor myself. My daughter
oh,
has a disability, and so at some point like you're trying to make as much money as you can in your career and do what they want. But there's this point where like I need to be able to balance
yep.
family and work, and then in the IT world working remote is not unheard of, and you can actually satisfy all the requirements. You don't have to
Yeah.
actually be in. I work with remote teams all over the world. India,
Wow.
people in Poland, people in Germany, people everywhere. And so you don't have to. The technology is, such as what we're talking right now. You can do it. Is this
Yes.
There's some mindsets that want you to be in that cube and monitor you and
Right.
physically be there because they have kind of an
Right.
old school mentality. But
Correct.
in medicine, what I want to understand is like, well, how does that work with telemedicine to a certain degree? The things that you can do and the things that you can't do, or what you've been able to actually, you know, accomplish remotely.
Yeah. So, I would say with doing virtual care, I just graduated with my master's in business administration. So, medicine and compensation for doctors is one of the few things that has not increased with cost of living.
Yeah,
So, to be honest with you, that's why it's so hard to find a good independent primary care doctor because oftentimes the math is not math for what the operating costs of a in-person clinic are. And so, with being fully remote, I actually wanted to kind of find a way in the middle to be able to say, how do I help my patients as much as possible? How do I quarterback for them, basically? So, with my practice, we have a lot of technology implemented so patients can book their own visits. If they need to send us a message, they can text us. We do evening, weekend visits. And just like this morning, I had a patient, she was like, "Hey, I'm having this pain. I just wanted to talk it through with you so I didn't go to the ER." And I
yeah.
had those openings available for that patient. So they were able to stay out of the ER. We were able to order imaging same day. And if they needed blood work, we could send them for that. So utilizing technology with the telemedicine is the way that it works. So, if I need to send a patient to LabCorp and they live in Cincinnati, Ohio, I'm able to put in the lab order. It transmits to LabCorp system. I send the patient a copy of the order. They're able to go get that done. The other thing that I did is I went to a manufacturer directly in China before the tariffs, obviously, to negotiate costs for at-home physical kits. So patients are able to monitor their health. So we provide weight scales, blood pressure cuffs, and pulse oximeters. What's interesting is that health insurance companies do not cover preventive kits for people. If you have high blood pressure, yes, they'll give you a kit. If you are overweight, yes, they'll give you a weight scale. But if you're trying to prevent that from happening, they don't cover it, which is why I kind of took it into my own hands to make sure that I could monitor my patients in real time. But I would say, primary care is really, I wouldn't say paper pushing, but I'd say decent majority of it is paper pushing and also making sure that we get our patients to the right specialist. So one of
Mhm.
the things that distinguishes my practice is, if a patient is like, hey, I need to see XYZ specialist, we utilize AI to actually find great specialists for them to see that accept their insurance. We kind of make sure we send the information to the other doctor's office, make sure that the patient has the information as well. And so it's kind of a seamless process. And then if they do end up needing in-person care, there's statistics that in-person care is only needed about 5% of the time, and that the diagnosis is usually 9.5 times out of 10 correct via telemedicine or in person. We send them to in person, and we end up, helping to connect them with the center beforehand, so they're not having to go there and re-explain their story and everything.
That's really interesting how you're able to leverage, the tools I've been leveraging for years. I've been like remote since like 2020. And
Wow.
And it is like the technology, and we use AI. AI, people are scared of it, but it's a tool like any tool.
It is.
But one of the things I want to understand in terms of like the nature, like the broken nature of the healthcare system, because being a cancer survivor myself and my wife going through it, what I've seen just in the industry, if I just give my own experience, like when I had cancer back in when I was 27,
Oh,
uh,
wow.
I had a level 3 sarcoma, and I had a healthcare plan through my employer, and it took care of most of the cost. And that whole thing back then was like $40,000 worth of going radiation surgery, maximum radiation
Yeah,
therapy, two surgeries. It was like 40 grand. My wife has smoldering myeloma, and she's gone through a lot of treatment. It's been like hundreds of thousands of dollars.
I bet.
And just the healthcare cost back when I was single by myself working back in the 90s, it was maybe $300 a month for like a HMO. My plan through my employer right now, I'm paying over $2,000 a month.
I bet.
And then the interesting thing what I'm wondering is like you're saying like you're not getting a raise, but as a like somebody paying for the care, my cost has gone up like exponentially. And then to hear that the doctors aren't getting that, so is what's going on? Or is like who's getting the money?
The insurance company,
So
that's who's
that's
getting the money.
so the for-profit model, which a lot of people argue for, is like, well, that's going to give us the best outcome. But my understanding is I work in software for insurance companies, and I help design those underwriting systems, and I understand what they're doing.
Mm. Oh,
They're
yeah,
trying to maximize profit.
correct.
They work with
Yep,
like actuarial-minded people.
correct.
Actuaries, all they care about are the pennies and the
Yep,
profit motives and the ratios and
100%.
stuff. And that doesn't necessarily give you the best care outcome.
It does not. It doesn't. You're
But they
absolutely
kinda
correct.
told people like, "Oh, it's capitalism, it's gonna give us the best
Right.
outcome." It's like,
Yeah.
if you are just in it for the profit, and if you're just selling, you see all these advertisements for pharmaceuticals, and they're like,
Yeah.
they're trying to get people to go and buy their product.
Yep.
But what is it is like, is that really what you need, or are you just being sold like a Coca-Cola or like any other product? You're being sold a product. Like, it's your health.
Right.
Shouldn't it be from a perspective of do no harm, Hippocratic
Correct.
oath, do the best, instead of like, oh, let's sell this new shiny pill or new shiny
Right.
thing. It's so it seems the motivation is not coming from the right place.
Correct. And I would say as someone who holds a master's in business administration, um, businesses' responsibilities to their shareholders, right? So we haven't decided as a country whether healthcare is a privilege or a right. So right now, it is a privilege to be able to have a job that allows you to have a PPO plan or a plan that you don't need referrals for, and you can just go see whatever specialist that you want. All of the marketplace plans, like let's say you're a self-employed person, they either have PPO plans that hardly no one takes, or they have HMO plans that are very hard to navigate without a primary care doctor. Oftentimes, I get calls from patients asking to switch me over to be their primary care doctor because the doctor listed on their card isn't even practicing anymore. It might be a pediatrician paired with an adult. A lot of these plans have super high deductibles. And so as soon as you're paying for this monthly premium and then you still have to come out of pocket for everything. It's really disgusting. I would say that, as a primary care doctor, I hear so many things online. They're like, oh yeah, the doctors are getting paid. I'm like, you don't see doctors in Ferraris?
It seems like the insurance companies are getting like
Correct.
the premiums are so crazy. Like
Yeah, they're ridiculous. And
I
there's no
mean,
cap, there's no, there's nothing. And so with the Affordable Care Act, there were a few things that, were put in place, where children could stay on their parents' plans until 26. They also made it so that, there were subsidies for the health insurance plans. And then during the first administration of President Trump, he actually made it where you could purchase insurance across state lines. So that's when a lot of companies started buying insurances in different states because it was cheaper, et cetera. But I think part of what has been left out of this process is one, the doctor is no longer making the business decisions. And I'm not saying every doctor is built for business. I can't say that. That is a special
yeah,
skill set. However, but when my dad had a patient that was sick, they had pneumonia, they may not have had the money to pay, they could say, you know what, we'll bill you later. It's okay. Don't worry about it. And they were able to have that direct relationship with their patients. Now, the computer really separates a lot of stuff with patient care. And if you don't use it the right way, it becomes cumbersome. Some people are like, oh, I've got to get onto the computer to log onto the patient portal to send a message. Some of these programs are not even mobile friendly. A lot of times, there's so many other barriers to even calling the office and saying, hey, I have a cold today. And they're like, yeah, we can see you in 3 months.
Yeah, it's like,
What?
but it's like the decision making tree because I work with the admin systems, right? And they're like they're not really doing to be an advocate for the patient. They're being an
Yeah,
advocate for managing the care. Like they're managing
correct,
rationing care
correct.
for the most profit. So if they can get
Yep,
away with it, like my wife is in the middle of like cancer treatment, and they went and said that they were going to deny like a service that's part of like a cancer therapy. Like where else is she going to go? Like
right,
it's like then they say, oh, it was an error. But it's like we were ready to just fight it because we like
right,
if when it's cancer, like it's a life or death thing. You got to fight it.
right.
And some people might not realize is like you have to appeal. You have to appeal as much as you can.
Correct,
You have to go
correct.
and challenge and then be involved in
Yeah,
your care. Because it's
I
one
totally
like
agree.
yeah, because I mean when I was a cancer patient when I was 27, I had a doctor that actually was going to potentially put me into a theoretical study where there
Oh,
was a
wow.
placebo potentially. And I had a level 3 sarcoma. So I could either take that care and maybe it's not even gonna do anything, or I was gonna go the route of actually the surgeries and radiation therapy. So I just kind of being a Bowdoin College grad and kind of thinking it out. With that, I was like, if I got a 50-50 shot of not actually getting any care and this thing's a level 3, what if it goes to a level
Right,
4?
right.
So I made a decision, but like if you don't have like the mindset to
Correct.
actually
Mm-hmm.
ask questions and
Yep.
challenge what your doctor's doing, they might tell you to do something that's not in your interest.
Correct. Correct. And I
So it's
think, unfortunately, the way that these private equity companies have come in and purchased practices, like I remember back in the early 2000s, right after 9/11, really, there was a lot of, pushback from doctors on the East Coast of saying, like, hey, all of these patients came in, it's in the 2000s, we should be able to have electronic health systems. We should be able to know someone's blood type. The system should be able to talk to each other. All of that stuff in theory is actually really more than appropriate. And I think in theory it would have been great. But what ended up really happening is that all of these tech companies got grant funding and special funding from the government to come up with these systems that most of them still don't talk to each other. A lot of doctors that were in my dad's generation say, you know what, this computer, they were kind of afraid of the computer, to be
mhm.
honest with you. And they just ended up saying, I think I'm just going to sell my practice. And so these private equity companies started coming in and purchasing these doctors' practices. And they're like, hey, we'll deal with the computer. You can keep seeing patients, and we'll just handle all of the front end stuff and all the management side of things.
Work that used to be done.
And that was where things went wrong because now you have people that don't understand what clinical care actually is, what it all entails. And you just have these business people coming in saying, we got to see more patients. We have to see more patients. We
It's
have
like
to
a
see
bunch
more
of
patients.
tech bros come in, and I love, the tech bros give us AI, but the problem is the tech bros, they have this mindset of they like to, like, they like to destroy things. Like, the idea is they like to go and do something and kinda see what shakes out.
Yeah. Well, he
So
said,
they'll
I
go
think Vivek Ramaswamy was like, yeah, there's going to be a lot of broken glass.
yeah, well, they have like, if the Hippocratic Oath says, "Do no harm," but your tech bro comes in and says, "I'm gonna go in and have this kinda chainsaw mentality," and then see, "Oh, if I turn that off, planes will fall from the sky. Oh, maybe I shouldn't turn that off." But, like, you turned it off, so there's an
Right.
outcome, right? It's like so,
Correct.
there's some things like a fire department is not a luxury. Like,
Correct.
it's not it's like there's certain things like a healthcare to me is like the fire department, like the police department.
Correct.
there's certain
100%.
things that should be baseline. In some societies, in the EU, that they understand that, right?
Very
They
true.
understand it should be a baseline. We have not figured it out because we have these people with this Horatio Alger myth. They think they're gonna be Elon. They think they're gonna be Henry Ford, but you're not gonna be there. So if you can't get a free education, you can't go to college for free, and you can't get
Right.
baseline healthcare, your outcomes in life, you might not do that well,
Right.
right? The idea that you're gonna win the lottery and be
Right.
the next tech bro is
Correct.
not likely. So you
Very
probably
not likely.
want to have better health because from health you can have other things. If you don't have good health,
Correct.
where are you gonna get? How are you gonna get
Correct.
anything else?
Correct. And that's, I mean, most of my conversations with my patients about their health have really nothing to do with the actual patient care. It has more to do with, okay, are you eating healthy? Are you exercising? I have some patients who live, in the middle of the hood and they're like, hey, I can't walk around my neighborhood at night. My apartment is too small to put a treadmill in here, or hey, like me going to the gym super late, something could happen to me. And so, it's all of those things, like social determinants of health that really matter. And so, a lot of these clinics are screening for this stuff, but where is the actual assistance? Where is the actual, plan for how do we start to make sure that everyone has equitable health outcomes, right? And so when it comes down to looking at how insurance companies, are able to charge more based on age, they're able to charge more based on, the risk stratification of people. And, to be able to do that and then to deny care for someone after you've already taken them through all of this stuff just to qualify for health insurance. And then for this current administration to, which, every administration usually come in, like, we're going to fix healthcare. And, especially
Yeah,
federal, oh, they love it.
it's
Oh,
not
we're going to
really
fix
about
it.
but they're
Right.
not
We're
about
going to
fixing
fix
it,
it.
they're about taking it down. They're not even
Well, they
pretending
say
to.
that, well, I think they think that they're going to fix it and they think that that they're going to be able to just like do a couple of pieces of legislation and things are just going to automatically get better. And it doesn't work that way. And so what I often end up finding, like you see people on the campaign trail, like, yeah, we're going to eliminate Medicare and Medicaid and we're going to do it, so people like cheering. And then they get in office and they're like, oh, maybe that's not a good idea because I actually see the
Well,
budget.
the other
Okay,
thing
never
that
mind.
well, if you think about I don't know, when you think about overall care, right? Like a lot of people, if you're a young person, you never think you're gonna get sick. So
Right.
you might not think it's important to have healthcare, so you won't buy it.
Correct.
So the idea of like the ACA was like, oh, people, and we're so individualistic that people couldn't think, well, cancer ain't gonna happen to me. Heart disease ain't gonna happen to me. Diabetes is not gonna happen to me. Like
Right.
these diseases aren't gonna happen. But that's not how it is. And so the idea is like, well, I'm gonna make the people who have the disease pay for the disease. That's not how it
Right.
in a society. If you want to solve it, you have to have this kind of like Social Security. The idea
Correct.
was we
Like
didn't,
everybody does their part.
yeah,
Yep.
'cause before in the 20s, we learned a lesson of the elderly people were just dying, right? FDR saw all these people not being having a respectable that we weren't treating their elders with respect. So the Social Security came about because you could just fall off the cliff and have nothing.
Right.
And what the misunderstanding with like these people who just want to destroy things and just think everybody should just work, work, work. Like sometimes you have something that doesn't allow you to do that. Like sometimes
Correct.
you have situations and this idea that everybody's just irresponsible is to me is this mindset is just like you have to go get it and that's it. There's no
Pull yourself
compassion,
up
no
by your
empathy.
bootstraps.
Yeah, that's not very I don't know 21st century to me.
It's
It's like
not.
you're trying to go back to like 17th century, 16th
Right.
century, and robber barons. I like that's what you think like that is not going to be a good the working person, the middle class person is not going to do well
Right.
in that kind of scenario, but they just somehow think they're going to win the lottery
Right.
and do well. So it's like it's a mindset change to make people understand that it's a socialism. It's like, well, Social Security is kind of like a socialist idea.
Right. But I think if you look at the you know, and this is, not to slight any administration, but if you look at the administrations that are talking about eliminating Social Security, um, what I learned about Social Security is that it is often borrowed against, and that that money has to be put back into
Well,
the
it's been
pot.
borrowed
And
against
so by just
for
right,
wars. I mean,
right, and so by not putting that money back, if you just eliminate it, then you don't have to pay it back. And so I think, I was watching I think something Joy Reid was talking about when she was talking about Social Security. But yeah, I mean, I think, we've gotten it wrong with healthcare. I think Medicare was a great start, but even Medicare is decreasing physician reimbursement rates, and doctors are actually the ones doing the work. I have, friends of mine who are surgeons, and they're fighting with health insurance companies to cover surgeries that they did 6 months ago. And I think one of the things for me that really, I'd already kind of shifted my mindset as far as like, the business side of medicine, but one of the biggest things that shifted my mindset just in general about where the state of our country is, especially when it's regarding health, wellness, safety, is once the CEO of United Healthcare was gunned down in the middle of the street. I'm sure you saw that.
yeah,
Um, 2 or 3 days later, they had his job posted. And I remember being in a group of physicians, and they're like, if you are thinking of not using your paid time off because you want to make sure that you don't let people down or your employer down, think about what just happened with this situation. Like, I mean, he wasn't even 6 feet under yet. And so um, I think that we have to separate business and compassion when it comes to things that are necessary for people to live, right? And
yeah.
so if people are not healthy, they are not going to make the right decisions. If you have neighborhoods where McDonald's is on every corner, you only have McDonald's and liquor stores and bodegas,
Yeah,
and then another
food
neighborhood,
insecurity. Yeah, food deserts. If you have food deserts, like how are people
correct.
gonna have
Right. And then
education?
when you take away free lunch programs at schools, when you take away discounted lunches, when you take away free pre-K and all of those sort of things, like when you start looking at education, you start seeing how a lot of these children are being put into a school to prison pipeline. And so it's really when you sit back and look at everything, and this is what my health policy fellowship taught me. It said always follow the money. So like if you notice for a lot of these southern red states that are very reliant on the government. They're the main ones that are like, oh, we want to cut all these services and we want to
Yeah,
do
but they're
this.
the
And
ones that use the services.
right. But then they also are the ones that are building prisons in
Yeah,
their smaller communities. And they are the ones that are employing the people of their districts. And so it all follows back to money. I would also say that I think the Affordable Care Act could have done more,
oh,
but
yeah.
that's when you start to look at how legislation is actually done. People sat down, they wrote all of this stuff, and then the lobbyists come in and then they say,
But they kinda
hey, Mr. So and so, I'll pay you, we'll contribute to your next campaign $150,000 if you take this line item out. If you can do that, that would be great. For
it's kinda
instance, I was very disappointed with my state senator when I lived in New Jersey. I'm not going to front him out, but he voted against a bill that another senator put in place to allow Americans to buy drugs from other countries.
yeah,
I'm
but
like, why would you do that?
I
And
think
then
they
I went back and looked, and he got $25 million from Big Pharma for his previous campaign.
if you look at what the corporations kinda do, they kinda design some of the stuff is designed to fail. But
Correct.
if it was designed to fail, the ACA was kind of set up to fail. It caused a lot of private insurance to become very expensive. Kind of what I'm dealing with, having to pay like 2,200 a month for a plan that used to be 600 or $800 a month. And so it's designed to make people think, well, healthcare doesn't work. And also, like if you look at like the prison industrial system was kind of designed to replace the old plantation system.
That part.
It's on purpose. There's certain, and so the thing that start not making sense because if you say I want
Correct.
to bring industrialization back to America, what if you want to understand industrialization that happens in the East, right? In the Eastern factories, they're in Taiwan, China, and Japan. The level of technical capability of the workers in those factories is not what was in the mills of our industrial
Mm,
age. Our educational system does not produce enough
no.
engineers, enough
Nope.
technicians. they're up at the level to actually work. If you wanted to bring those factories here, you'd
Correct.
actually still have to have immigration, I-9s to bring people in to do the work.
Correct.
So
Correct.
they're telling the stories like the factory work that has to be done today. It was CNC machines, highly technical
Yep.
capabilities that you have to have a technical associate's degree at a minimum, probably a bachelor's degree and even a master's degree.
Hmm.
Some of the stuff that's going on in these factories,
Yeah.
and they're telling people. So what do you end up going to do? You're going to end up being like you're kind of sending people into this prison labor where you're getting prison labor
Hmm.
working in the McDonald's, working
Yep.
in the
Yep.
third shift cleanup shift. So what
Yep.
are you doing? You're just creating like very low cost labor. You're trying to
Correct.
make us do like very low level labor and not even have a good quality of life. So there's no kind of going back to this golden age. So people
Right.
need to understand like healthcare for all, it should be a right, and people need to kinda stand up for
100%.
human rights. I
For
think
sure.
that's really the mindset, but people are still kinda playing the lottery game.
Well, I think we are a very selfish society, and everyone is in it for themselves. Everyone's in it for their own, oh, this is my view, and this is what I think. And, it's not a real like collective sort of like, hey, we've got to help lift each other up. No, it's, like you even saw within the last election, there were groups of people that were so busy worried about other groups not getting ahead that they voted against their own
Well,
interest.
you had unions vote against their own interest, right? And now you've got unions that are like, "Oh, what did I do?" Right? Farmers that vote against their own interest, and now they're getting hit because they got told that the other is the problem, and
Right.
you're voting for, like, a robber baron's interest, which is to deregulate, to pollute the water,
Hmm.
pollute the air,
Yep.
and you're gonna
Yep.
get cancer, and you're gonna get sick. They have enough money to take care of it, you don't.
Correct.
It's
Correct.
like,
Correct.
they either gonna break your labor union, so you're gonna go from $30 an hour down to 15, down to 8, down to
Right.
7, right?
Exactly.
So how does that interest you? Like, you're
Right.
voting for the boss. Why would you vote for what the boss wants when the boss wants you to go from $30 an hour with protections for ownership
Correct.
protections and all kinds of
Correct.
stuff, and making
Yep.
sure you have a decent health plan, have a decent pension plan, but you go and say, "Well, no, I'd rather work at the Walmart warehouse for 15." Why would you wanna go from 30 to 15?
It
Whose
makes
interest is that in?
absolutely no sense. It,
It's like
it absolutely makes no sense. But it also depends, I think, on messaging. And so I think a lot of people, if you look at, and this is something that, I will say that when you look at various sides of politics, right? You look at the fact that sometimes certain sides will use words that are so big that the average American doesn't even understand them.
yeah, it's a little too much.
And they're like, and they're using these big words. And so the college educated people are like, yeah. And then other, potentially less educated people are sitting back like, I don't even know what that means. And then they see someone say, like, oh, they're very good, or and it's very simple. And it's probably the same thing over and over again, but they understand it. And that's what they choose to go with because they feel the most comfortable with that. And then also, we have to address the elephant in the room. There are a lot of people that vote against their own self-interest because there has been such a focus on diversity, equity, and
Oh,
inclusion
yeah.
within in our country, and so it's like people have made this to be about a lot of times African Americans have made it to
Oh,
be
yeah,
about Latinos,
transcendent.
they made it to be about Native Americans, and instead of thinking like, oh, this is important for women too, this is important for adults with
Oh,
disabilities,
yeah,
this is
the
important for
DEI. But DEI, at the end of the day, DEI and affirmative action helped white women more than anybody else,
correct.
right? But
Correct.
basically right now you can replace DEI with it's black, or DEI with like gay, or DEI with
Yeah.
trans. So
Yeah.
it's become like a negative. And so now I've seen like thing where like a EPA project to prevent sewage from getting into a
Right.
black community was stopped because the word
Yep.
black, and he said it was DEI. what does that have to do with the
Right.
EPI regulation of sewage not hitting this community? So if it hit a community that wasn't darker skinned,
Yeah.
you could do it. So I mean, it gets to this point where now, all these like the Tuskegee Airmen gets pulled out of the Defense
Right.
Department.
Same thing
Like,
with Jackie Robinson, and it's like, whoa, like
so so how what does that got to do with affirmative action? What say so you can't say anything about any black contribution because that's so divisive. So they basically have just kind of taken the robe off, taken the sheet off, and
very
been
true.
really being very clear. And it's like and I'm glad I get to say it with somebody that understands it, but it's like it's really clear
Yep.
that they are, and Americans got to stand up and understand. It's like the Constitution is about equal opportunity, equal access, and
For
rights and
everybody.
freedom, due process. And what people don't understand is like, well, if due process isn't like, oh, well, if you're a green card, you shouldn't get it. If you don't give somebody with a green card due process, the next thing's going to be somebody who's a
Who
citizen
was born here? Yes.
doesn't get
There
due
was a
process.
doctor, I was just reading something today. There was a doctor who is an American born citizen, I think from Pennsylvania, who got a letter from and I haven't been able to like fully substantiate it and do my own research on it, but she got a letter that from Department of Homeland Security that she was supposed to leave the country.
Yeah, yeah, they're
Um,
sending that to
we have
people.
an American citizen right now in El Salvador who, like, they said he had on a Chicago Bulls hat, and that was enough to send him to the CCOT, prison system. And it's. I would say, from a practical perspective, that when it was happening to African American communities back in the '60s, people was like, "Oh, that's not my problem."
It's not your problem. Yeah, now it's happening to like
Now it's happening to
everybody.
everybody,
Yeah,
and it's scarier now because now the stakes are higher. Now it's starting to affect more than just one particular group of people. And so I think that, looking at it overall, we really have to decide as a country where we're going to go, because the route that we're going down now, it's not going to create more equity. And one of the things I was reading, it was saying that if you're going to say we don't want DEI, make sure you spell out we don't want diversity, equity, or inclusion.
yeah. Well, I mean,
But it
the problem
sounds better to just say the acronym, just like saying woke is,
the
as
problem I
opposed
have
to,
the problem I have with these people who are so anti, diversity is main advantage that America has is the melting pot. But it's
correct.
also it's the thing that some of the power moves, like to get balance of power moves, where these they people like to play the power game of
Yeah,
divide and conquer. Divide
correct.
and conquer, some people who are conservative have played it in a way, kind of going back to the Reagan era, where they kind of tiptoed around it and it
Yep.
was a balance. Now these guys have gone totally over to
Mm-hmm.
oligarch, totalitarian thing that Stalin,
Yeah.
Mao, and Hitler, and I mean any dictator does is the first thing they do is they go after the immigrants, and they go after the educational system, they go after the courts, they go after all the institutions and get rid of the
Yep.
trust. So
Yep.
then all you do is trust the dictator. And if you want to go that way, then what happens is you will not have very high GDP. You will not have a lot of
Nope.
innovation. That will go to other countries will have it. We won't
Correct.
have because immigration has created all the industries we've had have been people who have come from other places,
Correct.
or the diversity of our society has given us cultural capabilities like African Americans have contributed to culture is one of the biggest things we export. And
Yes.
African Americans have been responsible for billions of dollars of cultural capability,
Yep.
right? And then we don't get the credit 'cause a lot of times we get ripped off about in the structure of it. We don't get compensated for the work we do. But
We
the
do
fact
not.
is that we did the work and it's out there. And
Correct.
to act like we don't contribute, and the only people that contribute are people that look like the same people in the boardroom, you're gonna find out. You're gonna find out real quick that the GDP is gonna drop, that
Yep.
the innovation is gonna drop, the
Yep.
opportunities are gonna drop,
The
and
number of houses being built is dropping. the number of people that are picking fruit is dropping and all the prices are going up. And so it just, it's one of those things.
Counterintuitive. What they
It's
thought
worth
was
it to
going
F around and find out season, though, to be
yeah,
honest.
it was like, what's gonna bring it's the same argument that was in the Gilded Age. See, people don't know their history. In the Gilded Age, they
Right.
had tariffs just before the '29 crash, you know, and that it totally wrecked the economy, and the party that did it
Right.
didn't get back in for like 50 years. But the idea was, they don't seem to understand history. They don't like the liberal arts. They don't like to read. They don't like to understand about
Mm-mm.
political science and sociology and philosophy. They,
Mm-mm.
they don't want to
Nope.
understand the softer
You'll
things.
read
So
a Facebook post that's an ad that's running a million times and they read it so much. They were talking about how addictive social media is.
yes,
And they talked about how it really influenced the last few elections in whatever way the pendulum swung. But it was very interesting how you know even like people that have gone, switch sides politically or whatever, just talked about how much they were flooded with just ad after ad after ad about that
the
sort of stuff. And then
algorithms.
the algorithm, it is wow. And so, I was telling my husband the other day, I said, I wonder if when the people that created some of these social media apps, when they created them, if they thought about what the unintended consequences were.
Well, being a tech person myself, I'll tell you a couple secrets. The
Mm,
algorithms are designed by the tech bros. The tech bros in Silicon Valley are primarily white men, right? Or men who have this kind of tech bro mindset of the basically the manosphere. So you don't have to just be a white man to be in that manosphere. You can be, but it's male dominated. And it's very
gotcha.
conservative male dominated. And a little dirty secret in the algorithms, they're out there in all the major platforms, are designed by men who are purposely taking keywords and suppressing certain um, ideologies. So if you
Okay.
are a minority, if you're black, if you BIPOC, if you say something about gay rights or whatever, it gets pushed down in the algorithm. The
Oh,
things that get
wow.
pushed up in the algorithm are the right-leaning things. Now, because we don't have nobody ever thought to have the FTC or the FCC regulate the net, it's
That
gone
part.
wild, and everything that is kind of this, like, manosphere thing gets pushed up. There are more
Wow.
women than men in this country, but Joe
Right.
Rogan is the biggest podcaster, gets the biggest numbers, but we're more women on the net than men. How come that's the biggest thing? Because the
Mm,
women numbers are being suppressed. So
gotcha.
you
Wow.
have a structure that's suppressing other speech, suppressing other stuff, and so what you get is this repetition of this resentment mindset in the manosphere that's very toxic and has appealed to a lot of young men, multiple
Mm,
races, multiple ethnicities, and then it's actually even appealing to the women who are around these men. So now you
yeah.
get this plurality of people who are actually doing things against their interests because it's kind of like a mind control or very
Right.
Orwellian,
Exactly.
very
Yeah.
doublespeak. And if people don't know what Orwellian is, read 1984, read Animal Farm. There's a lot of this stuff was designed. I mean, if you go back to Richard Nixon, said we have to the professors are the enemy. Nixon said. If some of Nixon's people said we have
Yep.
to make sure the cost of getting a college education is very expensive so that we don't
Yep.
have what happened in the 60s. There are people who are architects of this. It's not by
Yeah.
accident.
Yeah.
It,
And Project 2025, during this previous election season, was very interesting how the current president was like, oh, I don't even know anything about that. I'm not going to be utilizing that. And
it's all
the the director of the Heritage Foundation actually wrote an article and he said the um, the Heritage Foundation has provided policy. I think he said over like 60% of the policies for every conservative
yeah. We go
um,
back to the John Birch
administration since
Society.
Reagan.
Yeah, the John Birch Society, like the Heritage Foundation, they've been running the same script. You go back to
Correct,
Reagan. But Nixon
correct.
Nixon has kind of set a tone, and then a lot of these
Yeah,
guys are
yep,
are basically for the unitary executive ever since Nixon.
Yeah, that
they
was
got
just like what they did with marijuana,
they
right?
got
Like there
black.
was.
Yeah, they
Have
got
you
black.
seen the documentary? It's a documentary with Snoop Dogg, and he was talking about kind of like the origins of marijuana. And I believe in the use of medical marijuana. I have a
Yeah,
lot of patients who benefited from it. It's
cancer survivor. I know.
exactly so great medicinal benefits. And so what was interesting is when I watched this documentary, I saw how um, LaGuardia, who was the mayor of New York at the time, was
Mm.
given this entire project to do to study marijuana. They wanted to see if it was dangerous, if there was anything like that. They came back after the study and said, "Hey, this is not dangerous by any means." They still scheduled it Schedule One.
Yeah,
And
I
then
mean,
it was
they were
almost weaponized to
gonna.
send people to jail for this little bitty quantity of marijuana. And now you see a lot of these same people from the crack cocaine epidemic still sitting in prison. And you also see people who have gone to jail for marijuana sitting in prison while it's obviously the same group of people that incarcerate everybody benefiting from making millions of dollars a year with legal marijuana in certain states.
Well, they wanted see, it's a matter of, like, who controls it.
Correct.
Yeah, so,
Correct.
like, they wanted to control it, and they also saw it was big in the counterculture. So, like, if you wanna you wanna be able to legally arrest the demonstrators, then you make it illegal. Something like if it was a cigarette that you could buy, then you can't just grab them. You have to trump something up. So
Right.
you have to create the situation. Same thing with crack cocaine is like powder cocaine don't get the same jail sentence that the
Right.
crack cocaine guy. Everybody, there's been tons of studies in sociology or
Right.
sociology
Oh
that go
yeah.
to that.
But you know what's crazy though is that, and I would say this was something that really disappointed me during the 2008 presidential administration, 2008 to 2012, was that the ratio was only slightly decreased, and then the 45th president came in, and they made it a 1-to-1 ratio with the stroke of event.
Yeah.
And
Well,
I'm
and
like, so then you have a lot. So it's like these decisions are being made, and it created a lot of division during the last couple of elections, particularly within the African American community, because it's like, oh, well, he got all these people out of jail, and the crack cocaine thing, and this could have been done with a stroke of a pen. And yeah, you're right, it could have been done with a stroke of a pen. Why wasn't it done? And so I think, as an African American, who's middle class, you almost are sort of like in this like holding pattern where it's like no matter which thing you vote for, we're always going to be at the last of people's mind. We're either at
oh
the
yeah,
first of
well,
people's mind that are voting against us, or our interests, or we're at the top of the mind for people that are supposed to be looking out for us, and then they get in office, they don't do anything. It's very very contradictory.
the
It's
problem
a
is
very
they go
interesting
in the
experience.
Constitution and we're still 3/5 of a human in the Constitution. They never got rid
It's
of it,
never been changed.
right?
Never been changed.
And at the end of the day, if you look at the Democratic Party and the Republican Party, and you look at both of them, they're all controlled by billionaires. Both
Correct.
parties are controlled by billionaires.
Correct.
Both cars are
Correct.
controlled by oligarchs pretty much. Now, the Democratic Party wants to have a sense of regulation that has more social justice than the other party. So they want to make sure that people don't get poisoned, that people have workers' rights, that people have
Right.
health rights. But at the end of the day, they still will lean toward the oligarch, right?
Right.
They will still lean
Right.
toward the business.
Right.
So, like, unless you get a parliamentary system where you can have percentage of voters for everybody, different parties, like the Green Party got representation, right?
Right.
Then the other types of parties are
Or
maybe
the
more
libertarians. Yeah.
conservative or
Yeah.
social justice parties would get
Yep.
representation, but
Not
they
enough,
don't want that.
not enough competition.
Yeah,
They
because
can't
if you have
even
this
like get
two,
ahead. If you try to run independent, forget about it.
yeah,
You
because
got to pick a
basically
side.
the billionaires have co-opted both. So until you have somebody that makes a decision, say I don't with their structure, until we get like an active and where our structure really isn't designed for three parties or four, but it's really designed for
Yeah,
two. So
it
it
is.
has to. It's a real structural struggle within our system to
Yeah,
actually get anything that's ever going to give us as people that we're like, oh yeah, I'm totally on board with that. Like it's like we're always going to get the short shift, like how much of a
Right.
short shift did we get?
Right.
We get a little bit better here, but not
Yep.
anywhere near the 40 acres and a mule. We're not getting that.
Correct. Correct. And that is unfortunately, part of the issue. Like when you think about African American wealth building, we have about a tenth in savings of what the average Caucasian family has. And so,
Yeah,
we can get car loans, we can get predatory business loans. If I were to try to when I started my practice back in 2019, I was, making I think what 200 some thousand a year. I just
mhm,
finished residency, stable, home, everything. And I went to, I'll leave the bank nameless, but I went to the bank
yeah,
and I'm like, hey, you guys, I've been with you for the last, I think it's been like 10 years, like since I was in medical school, like
right.
long time. And I'm like, hey, I'm going to start my own practice. I really don't need that much, but I really need to like get a building. I need to, be able to care for pregnant patients. I started everything on my own. I just kind of need some working capital. They offered me a high interest credit card,
Well,
like
that's been the
30%
story.
interest.
We're always getting redlined. Like, as a
Yes,
people, we get redlined
yes,
because it really goes back to the fact is you have like an inheritance gap, right? You have like
correct.
an insurance
Yep,
gap, wealth gap.
yep.
So if you've got a people that going back to 1600s, they've been able to keep on carrying that
And
over.
passing down that wealth. Yep.
You
Mm-hmm.
keep on carrying over the
Yep.
land, the wealth,
Yep.
the assets. But
Yep.
when did we get the right to vote? 65.
Right.
And now we got people still trying to pick at it, right? So it's like, so how much wealth building did you have before 64? Not
Right.
that much. And how much do you have now? Still not that much. So so
Correct.
and then you've got people who still have this historical bias when you walk in the door. If
Yep.
you're on the phone, if you were on the phone talking, they
Yep.
probably might give it to you if they don't see you.
Right.
I've run into situations where I would go for an
Yep.
interview,
Yep.
walk in the door, and they saw my resume. I get to the door, they're looking around the room, and
Everything changed.
they pass me. It's like, oh, where's Mr. Jones? It's like Mr. Jones is right here. And then it's like so that right there, the bias is like it's hard for people to understand that they want to yell about DEI. It's like most of the
Right.
time we've got to overachieve,
Yep.
and we're usually like at the top level, and they're
Upper echelon.
assuming that we're underqualified when we're overqualified.
Correct. And there was it was I want him so bad. Tucker Carlson. He made some horrible comments about black female surgeons. He's like, well, if I see a black female surgeon walking, I'm gonna think she's not as qualified. I mean, just like, and so
Yeah,
I sent him. I posted under, the video that was on there, and it was a lot of doctors who were really upset about it. I reached out to his production team, and I was like, I want the smoke. Please put me on your show because I'm going to prove you wrong. I was like, I'm a second generation physician, mom, wife, family medicine doctor, entrepreneur, MBA. I am everything you think we are not.
yep,
Crickets.
yeah.
So it's easy to say that behind cowardice comments like that are going to get clickbait from his audience, as opposed to actually having conversations to see how do we meet in the middle? What does middle ground policy look like? It just seems like there's so many policies that are either super far left or super far right. And it seems like the
That
days
middle
of
ground
people
is
working
hard. It's
together,
like
it's
radical to get
hard
there.
because middle ground isn't popular. It
Yeah, it's
doesn't
like
get
radical.
clicks. It doesn't get likes. It doesn't
No.
increase your viewership because it's just what it is.
Yeah, well, it's like I said, the algorithm goes for the Charlie Kirk who says that if they see a black pilot, they don't know if he can fly the plane. And that is so crazy because that black pilot most likely got trained by the, Air National Guard, Air Force,
Correct.
Navy, right? How many black people would have got a private plane lesson? And if you have a black pilot, they probably came from the Air Force, probably came from
Right.
the Army, came from the Navy,
Correct.
right? Highly likely that they really know how to fly because they're military pilot,
Correct.
right? But you're going to assume without
Right.
thinking or even having
Right.
any historical basis to assume that the pilot can't do it when they're most likely a military background, right?
Or they've gone through the same amount of training hours as any other pilot and
Yeah,
gotten their certification.
but they don't even think. They just say these things that this is like clickbait for
Correct. Yep.
the
Mm-hmm.
resentful
Yep.
people who
Yep.
don't understand the struggle that we've had in this country to this day, and they just like you walk in a room. I live in New Hampshire. If I walk into a room where it's a certain group of people, they just start the immediate
Right.
grimace.
All
They
the
don't
music
even
stops.
know. They have no idea who I am. So that's the problem, and they won't understand that kind of that feeling, because they just don't aren't empathetic enough. It seemed like maybe in the 70s, in the late 60s, people
Hmm.
understood that, but then something happened after Carter, after all that stagflation, and we got into this Reagan revolution, and ever since then, government
But
was
you
the
know what?
problem.
But what's
That was
crazy is that my dad, when he went to medical school, I think he was the only black doctor in his class. And so, people used to ask him, during Black History Month, obviously, they're like, hey, Dr. Evers, we want you to come talk to the students and this and this and that. He had a great experience in medical school back in the 70s.
yeah, it
Great
was a
experience.
different
Like
mindset.
he's still friends with all of, his classmates to this day. They hang out. And then you look at these medical school classes now, and it's less and less and less. It's more schools now, so it's kind of spread out. But I remember in my class of 220, we only had 5 African American students.
Yeah. I mean, I went to Bowdoin College in the 90s, and there was like 30 kids on a 400-seat campus, 30 black
Wow.
kids, and we had Republican people came to me in the lunchroom and told me I was there kind of affirmative action, some Reagan kid. Just walked out of nowhere and told me I was there because of that. I'm like, okay, so this is how it's going to start. This is how it's going to be. But that mindset back from '86 has gotten
Mm.
even more toxic than before.
Oh yeah.
It was toxic at that time, and now it's like in the total like it's radioactive now. It's
Correct.
unbelievable the level of the there was a level of maybe trying to hide it a little bit.
Right. That's
Now
over
nobody's
with.
trying to hide it at all.
No. Mm-mm.
And it's
Mm-mm.
just to me, it's
I
like you have to tell people like it's real clear now. So if you don't try to we can't really fudge it no more. Like if
Right.
this is very clear, and it's a justice situation. Like we've got to actually start talking. Like, do you really believe in the American idea, or is it all
Right.
just like that? Just is like a sales tactic. Like is that all just window dressing? What do you really believe in?
Right. And I think a lot of times when you ask people, when you try to, meet in the middle and you try to ask, well, why do you think that I'm inferior? And they can't answer the question. They say, you look at the fact that, with a lot of this actually, particularly in the healthcare system,
Mhm.
started with the fact that there were genealogists and quote unquote experts that said that there was a difference between the DNA of
Yeah,
black
what
and
they
brown
Darwin
people
is
and that our
Darwin
brains were smaller. Yeah, our
Darwin
brains were smaller. We weren't able, and so it's like, you look at all that, and all of that is carried through. There's still, studies that have been done within the last decade where they have screened, Caucasian medical students, and they said like, hey, I don't think, they feel as African Americans feel as much pain. I mean, and this stuff is documented, and so it's a
Yeah,
lot
I
of
think
this
the
has,
bad outcomes because
has
of that.
right, like I mean, literally, like it's traveled through our medical system. So you see how like a lot of African Americans don't get the right type of care. You see how Black women are dying in childbirth, and so you
Childbirth,
look at
yeah, our rates are crazy because like, they think we can take pain. They
and
don't.
they think we're lying. They think we're not telling the truth. You even look at Serena Williams and Beyonce. They
Yeah.
both have that. It happened to me, and I'm a doctor. I was delivering babies, having a baby, and the doctor comes in. She wasn't my doctor, but she came in and she said, like, hey, the baby's heart rate is dropping a little bit. And I was like, I already told the nurse that this happened. I told my OBGYN that this has happened. So it means it's almost going to be time to push. I know how to push. I deliver babies all the time. Like, at least check me to see where I am. I was 9 centimeters. She tried to have me push. A baby's head hadn't quite crowned yet.
Oh, your headphone went
Right?
out. There you go.
Okay.
Your
She literally, before she even talked to me, she had my husband in like the little white jumpsuit. And I said, take that shit off. I'm not having a C-section unless absolutely necessary. And I was able to call my doctor. I texted her and I called and I said, it's time for delivery now. She said, why didn't you turn her on all fours? They're like, oh, she had an epidural. She's like, it doesn't matter. We want to save mom, save baby. And so just even going through that myself was something that just kind of let me know, like, we've got to do a massive overhaul of how we view other Americans.
Well, I think it's how people get taught that scientific Darwinism is still ingrained
It's ingrained, correct.
in the canon. Like when you go to college and you learn the canon, right? You're still learning like the Shakespeare or the kind of European focused, Western focused stuff. Nobody's focusing on African American history. It's like American history without the African American history. Like you have to have it as a separate program. African American history is American history. Why is
Yep,
it separated out?
correct.
And then why do you have the social? Why is that scientific Darwinism still in there?
Right,
In the science classes and the biology classes. So if people get taught the sciences and then they're sometimes science focused majors don't take the sociology and the history because they're so into the sciences that they
right,
don't get the balance. In order to
correct,
be a balanced individual, you need to have a historical
correct,
understanding. You need to
correct.
understand art and history and
Mhm.
literature and not just the canon. Other
Right.
people in the canon, like black writers,
But
you
think
know,
about but think
Asian
about what's
writers, like Native
about.
American writers, everybody
Think about
writes.
what Hollywood pushes though.
Yeah.
Hollywood is pushing drugs, they're pushing sex, they're pushing violence, they're pushing drug dealers and glorifying them. They're put like it seems like it's all kind of created to tell the stories that other people want to tell about us, and also glorifying athletes. And I'm not saying athletes aren't important. I'm not saying,
No. No, I
music
understand.
isn't important. But if you think about a lot of hip hop, it has very low frequency, which is low vibrations.
Yeah,
So a
well,
lot of people
you're taking
only,
advantage of the lowest common denominator. It's kinda like remind me of the black exploitation films
correct,
of the '70s. Like, you've gotta and I understand there's a subculture, and I know there are people proud of their subculture. But there was a point when you had, like, a De La Soul or you had a Public Enemy, and people were actually saying something,
right.
right, in hip hop. And then you get this point where it's like, what are you saying? You're mimicking a gang? You're mimicking street violence, you're mimicking domestic violence.
Right.
What is that? Right? Like we have people in our history that are great poets and great from the Harlem
Amazing.
Renaissance.
And nobody
Right?
even knows about them. You ask kids today, they
You
don't
need
even
to
know about
actually why don't you channel the Harlem Renaissance? Right? Why don't you channel like jazz and fusion and the legacy of the Stacks and Motown and the work we did there. And they even go back to Lead Belly and Robert Johnson and the blues people.
Yep,
They made all the art forms that we
yep,
created that have dignity to them. In New Orleans, you can still see it, right? In terms of the jazz
correct.
culture and the Delta blues. There's a lot of stuff there. They like we invented rock. Rock, the guitar that's all like that's black those are black musicians. I mean, like,
And that's why Beyonce made a country album. She said,
yeah,
this isn't a country album, it's the Beyonce album.
yeah, well, the country music is, like, inherent, in our culture. It's not just they don't just own, like, this renegade kind of, Civil War kinda, you know, Confederate kind of focused country. Like, there's always been this Americana that included, indigenous and African Americans that were all in that culture.
Yep.
Uh, and so there's a lot. My grandpa was from Morgantown, West Virginia, played a banjo, and
Yeah.
he was a coal miner. And in that community, the black people were doing all these folk songs. Yeah, and they were doing all these kind of hillbilly songs, but from a black hillbilly perspective, right? Like
Right.
Black Billy, not the hillbilly. But, yeah, it's a different type of thing, but I always was drawn to it, like Charlie Pride and stuff like that. So there's always been a history of us in all the forms, and it's like people. It's like it's not. You shouldn't just like. It's a subculture. It's like it's
Correct.
Black history. It's African American. It's history,
It's
right?
American
Which
history.
so it's
Black
important. You can't just
history.
now it's getting tagged. If you have Black history or African American, it's DEI, so you don't teach it. So now you don't even want to acknowledge
Correct.
our contributions, and that is like we were having trouble when you were acknowledging, but you had to look for it,
Right.
and now you want to make it so I can't even find it.
Right. It's like attacking the books in the schools and things like that. And, it's really unfortunate, I think, from the perspective of a country that, it was never really made for us.
Yeah,
And we have managed, as a people to make it work. And I think that it's about community now, and it's about creating our own communities and really trying to work through getting rid of that crab in a barrel mentality and saying, how do we start pulling our resources together? Because
yeah, don't fight
so
each
much,
other.
right. Because I mean, if you think about, like, I was talking to a friend of mine the other day, and he was like, we were doing better economically when we had our own small poor communities where we all stuck together,
Yeah,
and as opposed to now. And my dad was telling me a story a couple of weeks ago about my great great grandfather, who was also a minister. He wasn't able to go to the University of Texas at Tyler because he was African American, so he had to drive to Texas Southern University in Houston. He drove with my grandfather every Saturday for 2 years so he could get his PhD. My grandfather got his master's in education,
mm,
and he actually got a bond package passed for a all Black school in I think it was like Mayflower, Texas. And so they got a bond package passed through working together collectively. They were teaching people how to read, because you remember there used to be a
yeah,
reading test to vote. They taught everybody to do that, and it passed. And my dad said he never forgot that night, because Caucasians from the community came over, started burning things. They had a riot, and they killed a young Black man who was 18 at that time because they were so angry about that. And I personally think that when we come together collectively, we're so powerful. And so I think that as a people, we have to start
we have to go back to
working.
that. I
Yes,
think it,
we
yeah,
have
I
to
think
start working through that trauma.
well, it's like the HCBUs, or
Yep.
the black,
Mhm.
or the black colleges. A lot of times you have a better outcome.
Very.
Sometimes if you go to those schools, like,
Yep.
and not saying that if you go to Harvard and you won't, or Yale, you won't have a good outcome, but it's highly likely that if you go to the black college, you're probably going to create your own business
Correct.
rather than being in somebody else's business.
Yes, historically, Black colleges actually put out the largest number of Black doctors
And
in the
entrepreneurs, right?
country. And what's interesting is I think I initially wanted to go to USC or something like that. And my dad was like, I'm going to tell you a story about our family, and I'm going to let you decide where you want to go to college after that. And so when he told me about Texas Southern, I was like, man, I got a legacy to keep up. So I got to go. And creating those stories and teaching us our history helps us to understand how great we are. And so
Yeah,
I
you
think,
gotta have that pride,
correct,
and sometimes if you're in isolated and you're going to, like, the Ivy League, and you only find, like, 30 of you, like, other
correct,
kids on the campus, versus being like, my wife is from Barbados. So, in Barbados, it's not unheard of to see a black doctor or a black entrepreneur or a
right,
black banker, because it's a black country. So it's a different mindset, so the possibilities are not as stunted. Right?
yeah,
So if we give ourselves that opportunity when you go to a black college, if you go to, like, a chocolate city, and you're in a chocolate city, and you have a better shot of you being able to get the loan, because maybe you go to a black bank and the bank
yep,
gives you the loan, right? And
yep,
then you're able to get because sometimes we gotta start thinking, it's like, integration's great, and, that was the dream that Martin Luther King had.
correct,
But if people don't wanna let you in, then you
right,
have to find ways to get it, and there's other ways,
correct.
avenues, and sometimes it's like, "Well, what's fine?" It's like, "You don't want it? Then I'll go find it another way."
And I'll make my own table instead of trying to bring a
Yeah,
seat to
well,
your
Booker
table,
T. Washington
my own
point of view.
table.
Yeah, Booker T. Washington, kinda like, Tuskegee mindset.
Yeah, and what's crazy is when I started my practice, I, first of all, I needed to, get money to be able to live, right? Once the startup I was working at closed. But I said, I really want to take care of people in states that I wouldn't necessarily live in, but they still need healthcare. So, some of the poorer southern states, I started to take care of a lot of patients from there. And I remember taking care of a patient, one of my first patients who I saw from actually California.
Mhm.
And I remember taking care of this patient. They booked a visit because they wanted to discuss something that typically a person would say, oh, I can only see you in person for. Ended up, talking through it with her. And she's like, hey, I've tried to go to, urgent care to get a mammogram. I've tried to go to the hospital. I've tried to schedule with a primary care doctor. They're telling me it's going to take 3 to 6 months. And
Wow.
she's been dealing with this for so long. And she's supposed to be in an area where it's not hard to get health care, but no one was listening to her. So I was able to see her virtually, and we were able to get her mammogram done within the next couple of days. She ended up, unfortunately, being in her 30s, getting diagnosed with breast cancer. And I just thought about the fact that, I said, I can't try to fit the mold of what society wants me to be and what doctors that don't look like me have the resources for, because I don't have the resources that they have. So I'm going to do the best job with the resources that I have and make sure that I can support my patients as much as I can with the tools and resources that I have. And that made all the difference for me. And so when I started to become very confident and sure with my ability to take care of my patients, and saying, yes, I am fully virtual. This is why. And, these are the resources we
Well,
have.
you're able to get a good outcome because, like, you can get the appointment. You can
Correct.
get because you found a way through the tech. It's like that's the thing that we've always been able to do as Black folks in this country.
Yes.
When somebody puts up to close the door, we, like, open another door, and
Yep.
we kind of figure it out from the back other side of
Correct.
it, from the underground. It's
Correct.
always been that we've had to do that, and that creates pressure, and adversity creates opportunity.
It does.
So within jazz, we have this idea: there's no bad note, there's an opportunity.
Mm-hmm.
If you hit that wrong note and you're with a bunch of other experienced musicians that've got 10,000 hours of practicing, they hear that note and they say, "Oh, I know what goes with it," and the song doesn't stop; it evolves. So
Mm,
that's where the genius of our creativity can be applied,
correct.
like what you're doing. You're doing the same thing. Like, you
Correct.
found a way to get, like, it's not a bad note; it's an opportunity. I can actually get around this and find
Correct.
another mechanism and use this. Maybe somebody doesn't use this tool this way, but I can use it this way. And
Correct.
you get to the same outcome, or get to a better outcome.
I
So
think technology is going to lower the playing. It's going to level the playing field. I think if we start to get more Black and brown folks into tech and understanding what tech can do and how it can help us continue to make something out of nothing, I really think it will level the playing field, because for my practice to be as successful as it is, like, it literally was like an idea, right?
yeah,
And I'm like, okay, I want to have AI where it can do this and it can remind patients, and we're going to use this for this, and all of these like little things that just came together. It's incredible. And what's interesting is a majority of my patients are not African American.
yeah. Well, you're just able to work, in the field you need to work in, and it's like law of attraction. People get brought to you because you're radiating the energy. But like I think about, this is the age. This is like the information age, but it's a little bit more than that. This is like the automation,
Correct.
AI, robotic age.
Yep.
And so in this age, as a micro entrepreneur with a 3D printer or a robot and an AI, you could do something with the AI and robotic capability. You could do remote, surgery with a robot
Yeah.
in the future. That's what
Yep.
the future it
They're
holds.
already using robots. They're
Yeah,
they're
you
human
know,
operated, but they're the
drone delivery of, like, blood
robots. Yep.
work test, or pick up
Cool.
somebody's blood with a drone.
Yep.
Like, they come to your house and drop
Yep.
off the
Mm-hmm.
kit. You have a robot that actually does the blood work. It could actually do test.
Yep.
That
They've
could
got
be, like, sent.
self-driving cars, all that sort of stuff.
Yeah,
Yeah.
a self-driving car could bring the robot to somebody's house, and they actually could run a diagnostic test, and in the
Correct.
future, all types of diagnostic tests that you would have normally had to go in for, these capabilities would be in. And if you get the ownership of that thing like a franchise, instead of buying a McDonald's, you
Yep.
buy, like, this robotic testing capability that goes and allows you to do remote work that would have never been able to be done, right?
Correct.
Because it could still be your hands running the robot. And so
My plan is actually to create my own EHR that has all of the automations built for a a doctor to run a slim practice that eliminates 90% of the need for office staff. And I think the generation of doctors that are coming through now, they're not playing this nonsense with these insurance companies. A lot
No,
of these younger doctors I'm talking to, they're like, hey, I'm going to start my cash only practice at this point, and I'm going to do this. And I think
that's revolutionary.
right.
I
But I
yeah,
think there's a better way to be able to help more people. And I think by, trying to create my own EHR and trying to create the ability for, as there's a shortage of doctors, being able to identify how do we make sure that the care that people are getting good? How do we use, AI to kind of help streamline some of this stuff? How do we utilize AI to read images? How do we use AI to, stratify risk in patients? And I think it's really going to revolutionize the game. And I think it is
yeah, 'cause you have
leveling.
your own mainframe. I mean, you basically have your own, like, cloud computer that's specifically working toward your practice with your view, your vision of healthcare,
Correct.
rather than like, if you have your own kinda operating system that you tell AI to build, right? It
Correct.
has your values,
Yep.
has your sense instead of the insurance company's actuarial values,
Right.
which are for the shareholders. Like, so if you that's revolutionary. If you say, well, I want to be able to provide a funding method that I want to give care to people and allow them to pay me like the old days, where the doctor would allow you to would like the insurance company not just going to deny it. I'm going to
Right.
allow a funding mechanism because the AI will find the funding.
Yes.
Will find a way to be creative and find the bank that gives you the funding that allows the person to pay over time or
Correct.
to, and then get the services. So it becomes revolutionary that suddenly that money that person was paying into the healthcare insurance company can actually be used for the care rather
Correct.
than the profit.
Yep.
That's revolutionary. If if people, more doctors get in a collective like that, you can build your own set of doctors in a group collective that are all doing that.
Well, my
And
plan is to start a telehealth fellowship. We were preparing to write a grant for the NIH to be able to educate newly graduated primary care physicians who just finished residency and help them get their master's in business administration, give them an opportunity to learn how to actually run a practice and teach them all of the ins and outs, how to do standard operating procedures and sort of give them an immersive, experience. And then a lot of the NIH grant funding got cut. And you've got to reword everything to not sound like
but
you're
now
trying
you gotta
to.
get no, you gotta get a patron.
Right.
You gotta get some of these left-leaning patrons. There are billionaires that aren't
Help to do
fundraising.
that. Yeah. But
Yeah,
what we ended up doing is we said we weren't waiting. So
you're
we
talking
advertised for our fellowship. I've got my first fellow starting in July. She's a mom of two, really wants to, work on building up her skills. She wants to get her MBA. And so we're going to start this thing off slow and we're going to
micro level. Yeah, do it at a micro level.
do
So
it at
you
a
start off
micro.
small, bite size, right?
Correct.
You might have the big idea, but it
Yep.
doesn't mean you can't start. So
Correct.
so you
Correct.
start, and then maybe you get somebody to recognize and say, "Hey, other people want to fund that," right? But it doesn't mean that you can't micro level start it, and that's kind of like the thing going on in Africa with micro grants and like all over the third world, where people building these micro level entrepreneurial exercise to help people instead of having people just waiting for a handout.
Correct.
Allow them to actually build their own business so they can be self-sustainable. Teach somebody to fish, and you don't have to give them a bread.
Correct.
Yeah.
Correct. And there's a quote by Karen Civil, she's part of the music industry, but she's like a real like boss chick. I really don't know what else to say. She's just amazing. And she said, it was a quote, and I look at it every single morning, and it says, nobody claps for discipline, nobody cheers for consistency, but one day everyone will notice. Show up every day to fix your life, do it alone, do it tired, do it scared, just do it. And that's my new motto. I'm not waiting on anybody to give me something or to give me permission to do it. I'm just going to do it. And had I waited for someone to give me permission to open up my practice, I wouldn't have been able to help as many patients as I have been able to. And so now I'm transitioning from just doing patient care full time to now trying to build up the next generation of physicians who are going to know how to operate in these business rooms, know how to tell these, chief operating officers to F off. They have
Yeah, well,
to.
that's what you want. I mean, that's how you get, because when people get tired of the canon, they create a new one, right?
Correct.
And so, like, like, I'm tired of this structure. Then you get the entrepreneur that comes up with the new idea. So
Correct.
and that to me is the real promise of America, is that we have that ability to take that idea and make it happen.
Yeah.
Now we've got people actually going and making that harder, but it doesn't mean you can't do it. You still can do it.
Nothing has stopped us yet.
Yeah, we're just gonna. I just think it's really important to tell stories like the one we're telling tonight. We got a little over, but it was worth it.
It was
Um,
great. I enjoyed it. I could do this all night.
well, that's why I love to do these podcasts. But I want to point out you have ZaraMedical.com, and I'm sure that's how that URL if people want to get in touch with you and they
Yes.
want to find out what you're doing in terms of your entrepreneurial efforts here. And we do encourage people to click that. That will be fully clickable. We've been live on Facebook, LinkedIn, and YouTube. We will be on all the other major platforms like Apple Podcast, Spotify Video Podcast, Amazon Podcast, iHeartRadio. By tomorrow, we'll give you a landing page for people to kind of go back and check this out in further depth and check it out. But I want to thank you for being a guest on the show tonight.
Thank you for having me. It was an amazing conversation.
Thank you. Have a great night.
Bye-bye.